How big should my dental office be? This question is actually twofold. First, how much space is required on average for a given room count? We refer to this as room yield. This is a math equation. The second question is, how many treatment rooms should I have? That's a business decision. This video will clearly answer the first of these questions. However, to answer the second of these questions is a much deeper discussion with philosophical and business ramifications. Please see our article, How Big Can or Should a Dental Practice Be, for that. There is a long-standing tradition in dental office design that states that the minimum requirements for the square footage of a dental practice is 450 feet per treatment room, with an optimum size of 500 feet per room. And after the introduction of the Americans with Disabilities Act, it's been stated that room size increases throughout the office would require that the ideal number rise to 550 feet. This would mean that a 10-chair dental facility would require 5,500 square feet of available space. Well over 2 decades ago, our company set out to debunk these convenient measurements using lean principles. The great news is that for over 2 decades, design ergonomics has successfully produced comfortable, highly productive offices with room averages of less than 350 feet. This saves doctors hundreds of thousands of dollars in space and equipment costs, sometimes millions in larger offices. And it makes it possible for startup doctors to find space within their budget. Here's why this works. First, the Americans with Disabilities Act actually created minimal pressure on the size increases in dental practice. Yes, it created inconvenience. It required reconfiguration. However, when properly planned, the additional space requirements are relatively minor. Then, when you look at the difference between the stated 450-foot and 500-foot office plans, you'll discover that it's largely due to convenience and inefficiency factors for the designer. It's much easier for an architect to design with a 500-foot yield than to more carefully consider a compact and efficient configuration. Unfortunately, people tend to want to do what's convenient. Making a great office, not wasting space, and having it feel spacious yet efficient is actually very difficult. This brings us to our third consideration. Why is a compact office so much more productive? In order to explain this, it's most practical to use an analogy. I'm going to use plumbing. Most dental offices are slow, inefficient, lumbering leviathans. Think sewer plumbing. There isn't that much stuff passing through. It's intermittent, and it moves slowly. You need a big pipe for that. Think of the large amount of space needed to handle all of this waste. In this case, we're talking about waste of time, labor, and materials. By reorganizing dentistry using Toyota lean principles over 30 years ago, we were able to focus on flow. Flow is actually a rather complex concept. Admittedly, it is estimated that Toyota spent over $30 billion in its first 3 decades refining it to become the dominant player in their industry. It's a position that they've maintained for decades. In our study of Toyota for the past 2.5 decades, we've been able to increase quality, decrease stress, and markedly improve production, and as a result transform the flow of a dental practice, which reduces the requirements for space to as low as 300 feet per room for urban practices, 330 feet per room for startups, and 350 feet per room for legacy and best-in-class practices. This revolution creates a sustainable competitive advantage against future competition for practitioners who can embrace and understand the principles. Think of it this way. If the guy down the street uses 50% more space and spends 40% more to equip it, and the result is half the productivity that you have a forever sustainable competitive advantage. If you want to learn more about what's possible for your new or expanding practice, subscribe to our YouTube channel and visit us on desergo.com. And thank you.